Welcome to Ophthalmology Times Europe's Eye to Eye Innovation Series. I'm Felicity Thomas, editor of Ophthalmology Times Europe, and I will be speaking with Professor Manfred Setz from Berlin, Germany, about his personal experiences using the Oertli CataRhex 3 phaco system.
Hello.
Hello. So, cataract surgery is the most performed surgical procedure on the human eye today. With patients' life expectancies increasing, the patient populations are also increasing. How do you, as a cataract surgeon in a high volume surgery, deal with this challenge?
Well, first of all, the cataract surgery has been a very much standardized procedure. Standardized doesn't mean that every surgeon does everything the same, but most of the steps of the procedure can be very standardized and also rationalized without endangering the outcome for the patient, actually improving the outcome for the patient. So we're dealing with this by reducing the size of our surgical kits, having less instruments to be re-sterilized, and also having machinery that helps us getting very safely, rapidly, and securely through the day.
So workflow is important to your daily routine.
Of course, yes.
So how do you optimize this? Have you perhaps adapted your personal technique to improve your workflow?
Yes, well, the workflow improvement starts at different sides. It's the personnel, it's the setup, it's the amount of instruments, it's the machinery, but it's also the surgery itself. I personally perform cataract surgery in a little bit of a very specialized form. I do what I call visco-phaco emulsification. So I use a viscoelastic in the anterior chamber, just using the fluid in the back. So I reduce all the movement in the eye to a minimum. Also, the amount of fluid is reduced, and I hold the lens with the phaco tip most of the time using what I call an always micro-occlusional technique. I also do only micro-occlusional breaks, holding the lens, just using the phaco for breaking the occlusion and then pulling it immediately back in. Not sculpting, not carving, just rotating the lens out.
So you've previously worked with Oertli's portable phaco system, the CataRhex Swiss Tech. What were your reasons behind exchanging your equipment to the latest generation CataRhex 3?
Well, first of all, the system that I had was already very good. It's Swiss technology, it's micro, it's Swiss precision. What I like about the machine, that it's very reactive to what I do. As I mentioned before, we keep the lens at the phaco tip rather than having the phaco tip going for the lens. And this is what the machine does very, very excellently. By using a widened tip, I can actually hold the lens matter all the time and have a very controlled and very efficient phaco procedure. It only takes a few seconds to emulsify the lens nucleus by rotating it in. And when going to the new technology, at first I said, well, can it be improved? Yes, it can, because the new machine is even more sensitive to my little modifications. So I could improve by reducing the total phaco time even more than I had before. And I also reduced the total amount of fluid. I usually use around 30 to 40 milliliter per whole case. So we're using very little amount of fluid because we're not breaking occlusion so often, and the total fluid moved to the eye is reduced to less than 50 cc.
Have you been impressed with the post-operative results when using the CataRhex 3?
Yes, I have, because the CataRhex 3 has reduced my overall surgical time. It has reduced my phaco time. It has also reduced the amount of fluid that with my technique I move through the eye. So since there is less time in the eye actually looks even better the next day. We do see clearer corneas even in harder lenses. We do see a very quiet eye the next day. So overall, I'd say, taking all the cases, using the machine the current way with having less trauma, less exposure to the procedure, the eyes do look better the next day. So I'm impressed, yes.
So this system's obviously had a benefit for you in the surgery. Has it also supported your OR staff?
Oh yeah, I mean, that's always the little things, the little extras, like in every car, you look for the little details that, you know, improve convenience. First of all, it's all now front loading. All the reloading for the next case can be done from the front, and it can actually be done by just a sterile nurse. You don't even have to have this second person helping you to do this, because it's now all front loading system, all the attachment, all the electrical support parts, they're all up front. And this is not so easy to do this on a small machine.
And what of the lightweight design?
Well, I do work out of different surgical settings, so I have more than one OR, and I do have more than one surgical site. We work in different cities. And one of the major advantages of the machine that you can actually fit it into a pilot case. Before it fit in there just barely, now it's even smaller, doing more, being able to perform better, and it's even more downsized. So it fits in the pilot case, and if you want, you can still put an extra book in there to read.
So this system has been designed to work with the highest values while also maintaining optimum safety. What values do you use when performing phaco and irrigation and aspiration in your practice?
Well, there is a tendency to use high values and still having the control. My settings are actually rather medium to low, because I also use the visco surgical device as a dampener of all my fluid movements. But that's my special technique. So I'm not propping up the values, and I'm still very effective, but the system can work also with very high settings and still not disturbing any of the important tissues within the eye.
How do the various instruments involved in phaco, such as the handpiece and tips, affect your surgical performance?
Well, as I pointed out before, it's very important. I need a specific tip. I can't use a straight tip. I need a tip that actually opens up, that holds pieces of the nucleus, and I do my micro-occlusion and breaks inside the tip rather than outside. If you had just a tube system, which isn't widened at the end, you can't do that. So that is an important issue. Otherwise, I mean, any handpiece which is light in hands, it's not too heavy in the surgeon's hands, also is very helpful to have a more controlled surgery.
And is there a notable difference using this system when dealing with more complex cases or hard nuclei?
The machine, in terms of very hard nuclei, that's actually a 4+ nucleus. That's the only one where I don't do my rotating technique. That's when I do my classical divide or conquer, or actually I prefer chopping. Then it is very effective. You know, you wonder with what precision the phaco tip can enter the lens nucleus and still hold it without actually pushing it away, because there are some machines that actually push the nucleus away when you enter the very hard part of it. So even in a chopping technique, it is capable of holding the hard lens very well.
That's fantastic. Well, thank you very much for your time, Professor Tetz.
You're very welcome.